Hello, is this thing on?
Do you think they can hear us?
Nah, let's say it again. Hi, and welcome to the Gritty Nurse Podcast, an unfiltered discussion related to health and healthcare. My name is Amie.
And my name is Sara.
And we are your podcast hosts.
If you're listening on Apple Podcasts, Spotify, Google, iHeartRadio, Amazon, or any other podcast listening platform, don't forget to subscribe so you can get updates to when we have our latest episodes. Also, don't forget to rate and review us.
And if you like what you're hearing and you love our advocacy work, don't forget to go to www.grittynurse.com and click on the donate button.
As little as $1 or $2 a month for a total of $12 a year will help us with our monthly podcast costs, such as website hosting, our hosting platform,
audio equipment, and the time and energy it takes us to put out good quality episodes. We thank you and we appreciate you. Hi, everyone. Thank you so much for listening and joining in on the Gritty Nurse Podcast again. We're super happy. We have an excellent guest. We were going to have two guests, but today we're just going to have one of our guests. And Sara, do you mind introducing her?
Absolutely. So we have an exciting guest today, and she's going to be talking about stress and, everything related to it. And I'm really happy to introduce Dr. Jennifer Love, MD. She is board certified in psychiatry, addiction psychiatry, and addiction medicine. And she's a diplomat of the American Board of Psychiatry and Neurology at the American Board of Addiction Medicine. She attended medical school at Loma Linda University School of Medicine and completed her internship, residency, and subspecialty fellowship training at the University of Hawaii. She served as chief resident and clinical faculty at the University of Hawaii Department of Psychiatry before returning to California, where she is currently in group practice with the acclaimed Amen clinics. Welcome, Dr. Jennifer Love.
Thanks for having me, ladies. I'm happy to be here.
Thank you so much for coming. I think you're going to be able to hit on a lot of really good topics. I think mental health with the pandemic, it's such a necessary topic to talk about. And we're super happy to have you today. And I think Sara actually has the first question for you.
Yeah, so just kind of going off of that intro, we just wanted to know a little bit more about yourself, your work, and how you met your co-author to write this book.
So I've been in private practice for going on 10 years now. I used to work, I left the university setting and went to a big kind of managed care setting. I know Canada and the US are very different, but I kept getting in trouble because I was spending too much time with my patients. And they wanted me to just, like, the chair of the department literally said to me, look, they're coming in, your doctor, give them Prozac, give them Tramadol for depression and for, or Trazodone to sleep, and just send them on their way. And I'm like, but they've never seen a psychiatrist before. They've never seen an addiction therapist or medicine provider before. This is their first time coming for treatment. Like, how can you just throw meds at someone? So that wasn't a very good fit. So I went into the private practice sector because I can have 90 minutes with my patient, for the first time, and we can schedule the time that we need. And so that's just been a better fit and more of a connector. And there's more going on than something that you just want to throw a pill at, for anyone. My co-author lives in Norway, so he's not with us tonight because he's 9 hours ahead. And I didn't know he lived in Norway. I met him in Newport Beach at a coffee shop, and we were waiting on coffee and started chit-chatting, and he mentioned he's a clinical neuropsychologist. And I thought, oh, wow, I always need to know one of those because, I need to refer people for neuropsych testing. And, so we started talking for a while, and then he got out a flip phone, and I was like, what? Like, I was so confused. I'm like, what is this? That's always been my secret dream, by the way, to ditch the smartphone and just have a flip phone, totally old school. But it turns out when he said he's Norwegian, he actually is Norwegian, living in Norway, and his mom lives here part-time, so he was out staying with her. That's the flip phone. That was his American phone at the time.
Right,
So
okay.
we ended up becoming friends, and after a while, we just thought, wow, we could really have an interesting project together because we're so vastly different. He's a clinical neuropsychologist. He got into psychology relatively late compared to, coming straight out of university. He'd had a lot of really interesting life experiences, had been a PGA member, had done some psychological training for the Norwegian ski jumping team, which I just thought was the coolest thing. I mean, I'm a California girl, California and Hawaii. So I'm like, ski jumping? Wow, like, what's that? And we just thought, wow, with our personalities being so different, he's so creative and free spirited, and I'm a little more regimented, we'll say kindly, um, uptight, like totally anal. But I thought, I mean, I only have 3 board certifications, right? Um, so we just thought, what would happen if we got together and wrote a book? Like, we could really together speak to everyone. And so then we
Right.
Right.
decided, well, what are we going to talk about? But that was really the beginning of that partnership, was having these kind of two opposite but complementary voices in the field of psychiatry and psychology.
That's super amazing. And you know what? I think the reason why my co-host didn't actually say his name is because we were afraid of mispronouncing it. But
Yeah,
just seeing your book,
you totally read my mind. I've never
but
heard it out loud.
Okay, I will say it. It took me 3 months to learn how to say it. And I kept saying, can I just call you Dr. Hovig? And he's like, no. His last name is really easy. It's Cheltura.
that is such a beautiful name, and I would have never got that right.
Right. So it's Shell Cheltura.
Hopefully we'll get to speak to him as well. And this is where I say, like, people should never change their names for other people. You just have to ask the question, say, how can I do your name justice? Because I want to be that person that is actually saying your name appropriately. So I'm glad that you gave us the opportunity. So now, like, it's like our little cheat sheet.
I also love how you just met so randomly. Like, I feel like sometimes you meet someone and you don't know it at the time, but they do change your life. And, this chance meeting in a coffee shop resulted in this book and this great project that you guys developed together. I just love that story.
Yeah. And, if you're going to co author a book, and that's not exactly in my personality to do that,
I
again,
was gonna say, how did that work?
yeah, it worked very interestingly. But I think if you're going to pick someone, you're going to pick someone for me in Europe, in Norway, and someplace else, because then you get to go on writing trips. And so I spent a lot of time in Norway focusing on writing this book with him. And so, we can't do that now in the pandemic, but I'm really grateful that I had that opportunity to go and do that because I love travel. So it ended up being great. He would come here, and since his mom is here and his daughter is here, he'd have plenty of time, with his family, and we can work on the project when he was here, and then he'd go back, and then I go back there a few months later. So it was really fun.
That's super amazing. Like, how did this idea kind of come to fruition? So the book is entitled When Crisis Strikes. What was the impetus behind writing a book like this?
So, what a lot of people don't know, we actually started the book and finished the book before the pandemic. So we had turned in on January 1st of 2020 the first manuscript. The initial intention was, as we're getting toward midlife and mid-career, and you just start thinking about, where am I and where do I want to be? And we thought, there's a lot of people who don't navigate the changes that come in this life very well. When we look at the patients who come to see us, their parents or kids are getting older, their parents are aging, our friends start getting cancer, all these things start
Yeah.
happening. And it feels like the younger we are, I mean, I had girlfriends of mine getting breast cancer when we were like in our 20s. It's just
Wow.
wild. So you have all these grown up things that happen. But when I was younger, it would never cross my mind to go to a therapist. My generation, it wasn't cool. You didn't do that. And so we started thinking
Mhm.
about how could we take what we do on a daily basis and make this accessible for people who don't have access to us. And so
Right.
we thought, okay, well, we're going to talk about, we thought, okay, we'll talk about like breakups or divorce or something. You know, I live in an area where the divorce rate is 70%. It's
Are you
huge.
serious?
It's huge where I live. And there's different averages around the world. But publishers were like, you know, there's not enough market for this. And we're like, really? Like, that's a lot of people divorcing. But so we had to broaden the concept. And so instead of just writing about, you know, all these different crises, we thought, what if we took all the tools in our toolbox and rearranged them in a way that they could be used that is not too simple, that it doesn't really target the problem. It's not too complicated that people want to give up after the second chapter or the third chapter. So it's something that they can do with or without a therapist, but it puts what we do within someone's grasp. And so that's
Right.
how
Mhm.
crisis became generalized. And because I'm a lover of biographies, my whole bookshelf back here, you can't see, it's like the whole wall of the room. It's just people's stories. So we
Yes.
did the first half of the book is the 5 steps and how to use them and what they are. But the second half is stories of people in various different life crises and how they've applied these steps. So it was a topic that came together, I think, just out of our conversations of all the stuff that was just going on in our lives as we went through life.
This is where Sarah and I think this is, I don't know how we encounter the people that we do, because we are huge storytellers ourselves. Like, we feel that through our podcast and through sharing stories and experiences, that's how other people learn. And I mean, the style of your book with bringing in these stories and then applying your steps, they're so meaningful, and it actually brings that purpose to understanding how you can walk through such a difficult situation, but using these steps, how they might be able to help. So I love the aspect of the storytelling. It is, for me, it's just like, it's the best part, because we feel that stories are what bring truth and resonate with people.
No, I appreciate hearing that so much because I wanted to write a book for a really long time. And mental health and addiction medicine, that's my wheelhouse. But I want to write stories. I'm really interested in people. And so I had never
Mhm.
read a self help book before. And I intentionally didn't read any before getting started because I wanted to really push to find my own voice. And Sheltuda wanted the same thing. Dr. Hovick wanted the same thing. And so when we first got together, the publishers were saying, you know, when you co author a book, it's fine, but the whole book has to be cohesive as if it's one voice. And we were like, oh no, we are so different. Like, that isn't going to happen. Like, I can play next to someone in the sandbox, but like, this is my area and that is your area. And so I just basically said to them, you know, this is my voice. I'm going to write this way. And Shell's is very different. And we want to label the chapters. You know, so if I am blue and Shell is yellow, the book won't be green. It's going to be blue and yellow. It's not going to be this
Right.
mixture. The book did end up being green
Mhm.
on the cover, by the way, but it's totally like ironic. But we each got to have, you know, my patients tell me when I'm reading this book, it's like you're in my head. I hear your voice. And one of my 80-year-old patients said to me, it's just a little more snarky than I expected. I was like, well, good, because I am more snarky than probably you would know as my patient. And Chels is very different, right? And so we really needed to have that balance. And so I think it's beneficial for the reader because some people are really going to like my style and other people are really going to like his. But it's the same concepts.
Mhm. I think it just appeals to, like, it appeals to, like, a broad, group of people, right? Because there's, like, I'm not saying you're fire and he's water, but, like, it's just the balance, I think, that really just resonates with a lot of people. I mean, Amy and I are very different as well, and we've written stuff together, and I don't know whose voice is where, but we're both in there. And I think the timing of her book is just, it was probably good timing in retrospect, because especially for nurses and healthcare professionals, the pandemic has really brought to
Ugh.
light all of the PTSD, stress, mental health issues that we've been
Mhm.
experiencing. And especially here in Ontario, we're really advocating for more supports from the government and things like that, and sort of taking a more preventative approach to mental health, which is kind of what I think we all need to
Mhm.
do. So, are you able to talk a little bit about ways that we can sort of stay mentally healthy just from a preventative perspective? Because we don't always want to wait for something to happen before we take action.
Exactly. The problem is, preventative for us should have started in nursing school or medical school.
Right.
Right.
I actually
Yeah.
started college as a nursing major, and did the nursing chemistry and like all those things that everyone hates. And then I switched majors and ended up just changing courses. But nowhere was I ever taught to take care of myself. It was, and I had a roommate in college. She was a nursing major. And when she was on her clinicals, it's like, you go and you serve and serve and serve. And it's like, oh, well, try to stay hydrated. And I'm not sure how you're going to do it, but you're going to stay hydrated and you're going to eat at some time. We're not really sure when we're going to allow you time to eat. And, so I went through all of med school and residency already completely exhausted, gaining weight. I mean, you could read my story in the beginning of the book. I was sick all the time. I kept having these recurrent sinus infections. It was really just miserable. And even to this day, I still really struggle with how to make myself a priority. So when you come from
Right.
that mindset of the people around us always have to come first, and then you hit something like a pandemic and your hours are increased, or like, I don't know how it was in Canada, but in the US, personal protective equipment was not exactly in every hospital and people were having to
Yeah.
reuse it.
Yeah.
And we had misallocation, and I won't even get into the politics of everything that happened. But so we're in this place where it's just expected of us that we do more and more and more. And to be honest, we all are products of all of our past experiences. And so it's not like we
Hmm.
woke up one day and had this pandemic and like our gas tanks were full and we were ready to go.
Right.
Our gas
Right.
tanks have been lowering and lowering for, depending upon how long you've been in nursing. The two of you look like it's been like 2 years, but
You're so kind.
but like that gas tank rarely gets filled back up unless something major in your life happens, and even then you have to have a surgery. And I remember asking a surgeon once, well, how long should I be out for the surgery? And she said, oh, well, I had something similar. I was back in 3 weeks. And I'm like, okay, put me back in 3 weeks. And I went back in 3 weeks and collapsed and called her off. I ended up back in
Oh
the
no.
ER and was told, you're supposed to have 6 weeks off for this. I said, oh, really? My surgeon said she went back in 3. And, it was just this. So it was just this given that you just go back, and I couldn't even stand. And so this year, I think this past year particularly highlighted our vulnerabilities and this idea that if we make nurses look like heroes, if we make physicians look like heroes, then how are they going to come complain, or are they going to strike? How dare they, because, we need them so much. And then you had the opposite. I don't know how it was in Canada, but in America, then it was like, well, we're not going to wear our masks. And, and so, our healthcare providers are like, I am putting my life on the line every single day because you don't believe in medicine. What happened this year, which is a slight tangent, but it's fascinating to me as a psychiatrist. There's a difference between a thought and a belief. If I think I'm
Right.
bad at math and I get an A on a math test, I can say, hey, maybe I'm not so bad at math anymore. But if
Right.
I
Right.
believe I'm bad at math and get an A, then I'm probably going to say, that was a fluke. Everyone got an A. It must have been an easy test. The
I know
data,
exactly where you're going with
yeah,
this.
the data won't change that belief. And so when something like medical advice and mask wearing became political, it got taken
Yep.
away from the part of our brain that has flexible thoughts and embedded in that part of ourselves that has to do with what we believe in. So you have people who believe that you need to wear a mask and social distance, or you do not, based on this as strongly as they believe, for many of them, in their faith, in their political belief system. And so we got to this point where medical knowledge was just lost, at least in our country, and
Yep.
it became a
Nope.
battleground.
It was here too.
So
Hmm.
it
Hmm.
made the year particularly challenging, I think, because in addition to having the pandemic and something that none of us has had experience with before, there was a lot of anger, societal anger, and it's on the news every day. So now, again, none of us came into 2020 with a full tank of gas, unless we're a year old, because we start depleting when we're quite young. I give the analogy somewhere toward the beginning of the book is how we all have a big stress bucket, right? And it's this huge bucket in life contains how much stress we can hold. And once it's full, one little drop on the top is going to push us over the edge, and we're totally going to
Yep.
lose our marbles over one drop. And it's
Yeah.
confusing if it's like, what'd you do with the toothpaste? And you lose your
Yep.
marbles over it, right? It has nothing to do
Yep.
with the toothpaste at all. It's that bucket is full. And so we all came into 2020 with just different levels of stress in our bucket based on our past experiences. And so we only, some of us had a bigger capacity than others, but we were all pushed to the max this last year.
Yeah, my God, what you've said has given me chills. Like, it is exactly the things that Sarah and I have been talking about in terms of the whole mental health crisis,
Mm,
because we have data too here that so the Canadian Federation of Nurses in Canada had written a report on mental health, and they're like pre-pandemic levels of the stress of healthcare workers. They were already numbers of 60% of people saying that they're going to leave their profession by the next year.
And
They're
I
already
think if I'm not mistaken, sorry to interrupt, it was like
yeah, no,
1 in 3 had screened positive for major depressive disorder.
yes.
And this was pre-pandemic. So we don't
mhm.
even have data from since the pandemic started. And that's what really scares me. So
We as Canadians, like we were watching what was happening in America. Like we were watching very intently into seeing how this all was unfolding in terms of the beliefs that you were talking about. And it was like, how did we go from we believe in science, we believe in evidence-based practice to know this is all insanity and whatever this person's saying can't be true, because we also had people, for example, that came from Canada that came to protest in America. There's nothing happening with the pandemic, and it's like I'm kind of wondering, I was like, what is the psychology behind these types of thoughts?
I think, politics in America, well, the United States of America, you are America also. Um, but we've seen a shift in the last certain number of years, we'll say, where suddenly it's not enough to say, okay, like global warming, you say this, but these are the policies we're going to uphold. It it's just an outright denial of the science. So we have been, and then you had president who initially forced the CDC to stop using certain words, and talking about
Right.
okay.
science-based and evidence-based, and we were all like, what? Like, it's given rise to what used to be fringe beliefs, and conspiracy theories have been granted a stage. And so we've really seen, I think, what's been hidden away for quite some time. It's never not existed. It's just been hidden away, and suddenly it became appropriate to, whether it's being racist or whatever it is. The anger that people have, that part of them that was always angry. It's kind of like Judge Judy came to town and she started yelling at everyone, you know. When I was in med school, Judge Judy was on. I never got to watch TV in med school, but when I got to, I loved it because she got to yell at all the stupid people. And every day I'd go into work and I'd be like, you know, sir or ma'am, you have diabetes. You really should stop eating tortillas or rice or, you know, like carbs or sugar, or like literally the guy in the hospital who's in the wheelchair. He's about to have like a below knee amputation because of his diabetes,
Right, right.
leaves his room and goes and he's piling up a plate of donuts to wheel off for breakfast. And I'm like, dude, you're about to get your leg cut off. And like, you're not allowed, you're not allowed to say those things. So I loved watching Judge Judy because she would just yell at these people. And I was like, yeah, you know, like inside.
Yeah,
And
I know the feeling.
but I think in a way, when there's a really unhealthy nature to anger, we all have anger over something. I was angry this last year when something just snapped with George Floyd. It was like, what the hell is going on? And I don't know why that one death stood out with all the countless others, but it just infuriated me that why are we still dealing with this over and over and over? So there's healthy anger, but there's also unhealthy anger that's rooted in misogyny and racism and all these other things. And when that's given a voice, it comes out as, you know, an invitation to being powerful. And I think that that has added to a lot of people's stress this year, because it's on the news. People are afraid.
Mhm.
And even my patients who, I live in a very conservative area. So I have patients who have just been thrilled with how the last several years have been going, but many of them have anger. One fired me because our clinic, we're working remotely because we have so
Right.
many doctors and stuff in the waiting room. We just can't make it. So we're open. We have to work remotely. And she said, I'm just not coming to see you until I can. This is ridiculous. Like really
Right.
angry. I'm like, okay,
Mhm.
it's hysterical, it's historical. It's my favorite saying, right?
I like that.
Her anger at me in this moment isn't, I haven't done anything wrong, right? So it isn't really about
Right.
this moment. Where is this anger at? And it's a sense that something's being taken from me. And I heard that a lot this past year. And I mean, we could probably do a 5-hour podcast on that, like medical women, like getting political.
So one of the things that you touched on was the self-care aspect, and we as healthcare providers are really really bad at looking at ourselves and saying, you know what, we need a break, we need to step back, we need to remove ourselves. And like you said, the whole healthcare heroes, nurses being heroes, physicians being heroes, and really I always have said that that's a huge smokescreen. So one of the things that has happened recently, and I know it's probably underreported, but I don't know what the pulse is like out in America, is we've actually had a few suicides here. So we've been really talking about, like, if you need help, please let other people know. And our healthcare benefits. Oh my gosh, I don't even want to get into issues with paid sick benefit, sick days, or issues with how much the government per se would actually give to anybody for healthcare, for mental health resources, whether that would be through your employment or whatnot, and they're really meager. And only certain services are actually covered. So, for example, we have our Ontario healthcare insurance plan. The access to care is virtually is so difficult to
Mhm.
get in to see a psychiatrist. It's like 8 months, or you're really entering the system through the ED department because you know you are in a full on crisis. So what's the pulse like out there?
Well, in a sense, like this book is about crisis, but we have a crisis in healthcare that's just as important, and the 5 steps can be applied to that. But I mean, I've been using them myself all through 2020. There's been a lot of burnout and talk about burnout long before the pandemic.
Yeah.
The US healthcare system is flawed, and people have been trying to work on it for decades. And it's not a great system. And it was interesting co writing a book with a Norwegian who, he has 100% healthcare. He doesn't have like a copay for anything. If he has a surgery or whatever, and he's like, "Oh, the government takes care of me." I'm like, I don't even get one day off paid. I don't have that. So it's hard for me in this area to even be really kind of neutral because I've been in this place myself where I have wanted to just hit the eject button. But of course, in the US, I'm one of the older docs, so my debt isn't as much as the younger ones. But I left med school with $250,000 of educational debt.
Oh
And
my
it's
god.
higher for the younger physicians now. So you don't just get to say, "Oh, you know what? I think I want to be a teacher because that sounds so great." And it's like, well, I'm probably going to get paid to be a teacher what I have to pay for my loans every single month. So there's this
Yeah.
pressure to keep going because at the same time, I finished my training in my 30s, mid 30s, early to mid 30s. And I didn't have 401k. I didn't have my retirement or anything set up because I'd been in school that whole time. So
For
I
that. Yeah.
owed $250,000. And then it's like, you got to live somewhere. And eventually you got to buy a house. And, I'm like, I have a really crappy car. Eventually I've got 200,000 miles on it. Like, I'm going to need something new. And you have to have this, and then you start pushing 40 and you're like, how am I halfway through life? And I haven't like bought a house yet. Like, how is this possible?
Mhm.
So there's, I think, this aspect of burnout and overwork and being underappreciated, I think, particularly in the mental health field, but it's for all of my friends, I think, who are in various specialties and subspecialties. And I think many of us have that fantasy of just, what would happen if you could win the lotto and not have to work, and,
Right.
or, my
Mhm.
Duke is going to come find me and then I'm going to go and get some chateau in France and have goats. And um,
Yes.
that's totally my dream, by the way. And I'm sure I'm not going to find a Duke, but, one of the things that writing was for me was learning how can I shift or exploring can I shift what I do to something that doesn't pull as much energy from me. And so we didn't use ghostwriters. The problem was we had to take our full-time job. So I took my full-time job and jammed it into 4 days. And then I had 3 days that I would write. And I did that for the year we were writing. And then I did that for the year we were in editing and COVID. And then, like, my doctor said, "What are you doing? Like,
Yeah.
stop." And that's one of the hardest things. There are only two people in the world who can tell me, like, slow down. And one is one doctor I've seen, not any doctor, just one in particular. "What are you thinking?" And she's in my field. And the other one is in my field too, and he's more European. And so, even like pre pandemic, pre health problems or anything, be like, "What are you doing? You work too many hours. This isn't good quality of life for you." And I'm like, I need to think like a European. So
I think it's just like it's really hard for us to slow down. It's really hard for us to take that time to say, "You know what? We actually need some TLC too." Like, we're out there day after day, we're looking after other people, but we need some TLC. We need someone to look after us as well. But one
Mhm.
of the things
Mhm.
that I kind of wanted to circle back with, and you kind of started touching on it, was about the 5 steps that you do mention in your book. So could you maybe walk us through, just really, we don't want to give everything away, but just really maybe briefly about the 5 steps and how do we incorporate them in our daily lives?
Yeah, so it's interesting. We came up with these steps and they correspond with the fingers of the hand. And it was Cheltura who first kind of had this idea because he's all into this philosopher who had this idea that the brain is, or the hand is the extension of the brain and all this stuff. And he kept calling it the hand model. And I'm like, time out. Dr. Love is not going to have a hand model. Like, I know you speak English, but our English is different than your English. Like, that means, like, no, it's not
That
happening.
means something else.
5 steps.
Completely lost in translation
Yes,
there.
yes.
I
Oh,
love
it's
it.
funny to make a Norwegian blush like that. It's okay, okay. But they are like kind of the fingers, and it's helpful. So the first step is the thumb. It's called get a grip. And it's really about understanding the problem. So you and I, both of you and I, the three of us, could have go through the same problem. Let's say we were in a relationship and had a breakup, and the three of us may have very different reactions to that. One of you may be like, yes, finally, time to go for that one over there. Or, like, I may be devastated and want to hide under a blanket for the next 6 months, because it's not the problem isn't the problem. It's the context of the problem and what it means to me as an individual. And so we have to do a little excavation. So we have to first look at the context of, okay, let's say I'm going through a breakup, and now we're in 2019. Well, how lonely is that going to be? And pandemic and all that, or maybe financial stuff. Like, what is the context going around? And then we need to dig a little deeper. And this is the thing, is to do the digging, you can't be escaping. So to really kind of get a grip on your problem, you can't come home from work every night and like drink wine all night long, or watch pornography all day on the weekends, or video games, or, you have to kind of curb the escape mechanisms so you can do the work to figure out, oh, I feel like a 4-year-old on the inside because my parents divorced when I was 4, and one of my parents walked out. So this breakup, like when I have times I'm so upset that I can't get my words out, that's this deep
Right, right.
wound inside. And that's why I'm the one who's going to be maybe regressed. And maybe I'm going to be like crying or a little labile, and you're going to look at me and go, you're being a little cray cray right now. And I'm not going to have the words to tell you why. And so you have to understand why it is such an issue for you, because those are the things that other people around you won't see. They're just going to see the surface problem. They won't understand the meaning. And the better you can understand it yourself, the better you're going to be able to communicate that to the people who are around you, and why you are, behaving the way you are, and why you need the help that you need. So it's really being
Right, right,
willing to
right.
dig in there. So that's the first step.
This is fascinating to me, because I think what you're saying is you just need to sort of face the problem head on. Like, you can't be running away from it and drowning your sorrows and things that are just going to numb your feelings. So I do like that. And I think people need something practical and tangible, like the 5 steps that you talk about. So I'm just wondering, do you have other sort of pearls or takeaway points for people maybe that haven't read the book? Or like, what can people do with just being in crisis and being in situations where they're chronically stressed? What would you kind of suggest to them?
Well, I would suggest they buy my book.
That's a good one. That's
Thank you for
tangible. I
that
like
question,
that.
Sarah. That was the best. Okay, so here we all respond differently in stress. It's like if your smoke detector goes off, your alarm's going off, and you can't do anything until you turn it off, right? It's loud, it's piercing, and you got to get the batteries out of there. You got to make sure there's not a fire, and then you get the batteries out there. And if you can't get the batteries out, then like literally I've taken a broom, because to me this always happens at 2 or 3 in the morning when they go off.
Right.
And
Nice.
so you cannot ignore the alarm. Our brains are wired to protect us, right? We have fight or flight, and our brains don't understand that as humans, we've evolved from living in caves and having to watch out for bears and wolves into suburbs. Most of us don't have to worry about wolves and bears. Some of us still do. But sitting in traffic or sitting in the boardroom, if you have a stress, your brain doesn't know the difference between that and a bear. The alarm goes off. And when you have
Right.
chronic
Mhm.
stress, it's like that alarm goes and goes and goes, but it doesn't have time to kind of just ramp down. If you have a bear, your body and brain are going to react and do all the things that are needed for you to survive that, to run away, to fight, to whatever. Your body's not going to be thinking about digesting, the hamburger you just ate. Everything goes to survival. And as soon as you're out of that situation, it's on alert, it's looking around to make sure you're safe, and then you can rest. With chronic stress, our brains still send off that same alert signal. And it's really hard to, if you don't have a structure to figure out how to deal with it, you cannot go into action until you understand what it is that's going on and you have an idea of how to deal with it. Otherwise, your actions will be the ball in the pinball machine. You'll be like running around but not getting anything done. Like me, when I'm trying to find which smoke detector is beeping at 3 a.m, just to find that they all are, and I have my broom because I don't have a ladder and I can't reach any of them. Not really getting anything done. So you have to, the steps really need to go in order. You have to have a good understanding of what you're dealing with, not just a superficial thing, but what it means to you. The second step we get into is the pointer finger. So it's pinpoint what you can control. And our brains will go through all the things that are out of our control in that moment. So list out what is everything that's totally out of my control. And then we walk you through the process of figuring out, well, what can I control? Whether it's your sleep, whether it's your schedule, whatever it is in life. And then what do we do? What can we do about the things we can't control? So we're not making a giant to-do list. We're taking that sense of helplessness that comes when the alarm goes off and we're challenging it. We're learning to calm that down. We're learning that we have the tools, even though we're wired not to sit in that moment and think through a bunch of options. We are wired to do one of two things, to run or to fight. And so it's really important to actually think about the things that you can be doing. And getting back to this idea of work, I did a podcast with, it's called the Clergy Emergency League. Um, Poor clergy having to deal with me. I didn't like drop any four-letter words. I was really proud of myself. But, you know, they feel like they can never take vacation. No one can do what they do. And, I said, well, this is what I say to myself. Are you really so special that no one can do what you do? Like, really, you can't take a break. Is someone going to die if it doesn't, and I'm like, well, in my field, yes. I have to be very careful about what I do when I go on vacation. But for most of
Right.
us, we have that sense that everything we do is so key. And if I don't do this, my partner's never going to do this. These kids are never going to
Yep.
do this. I
Mhm.
have to do it all. And the reality is, we can challenge that a little bit. Are you really the only important person in this family or in this situation? What would happen if you decided to change your role a little bit and give yourself permission to do that? Then we can get into the action phase, which is the third finger. It's giving crisis a middle finger, right? It's finding the fire in your belly to get started. So I use some motivational techniques that I know from helping people with addictions of how do you get started with these things. And Shaltura came up with this great idea of dividing things into easy tasks and tougher tasks and starting with the easy. And I do this on a daily basis. Before we even did these 5 steps, I realized that I was doing a lot of this. For me, when I'm really cluttered, my space around me is a disaster. And I hate it because I love having a home space that looks beautiful. And
Right.
when
Mhm.
I'm cluttered inside, everything's cluttered outside. And then when it's cluttered outside, like inside, like I just can't function. And so I do things
Right.
like giving myself a 5-minute clean. Literally 5 minutes, not a second more, and I straighten up everything within sight in one space. And that
Right.
actually can bring down your cortisol levels because clutter increases cortisol. And in 5 minutes, you can actually make yourself feel more calm and more
Right.
productive. And it's one of the most practical things that we can do when we feel like we have so much to do and can't do anything. So
Hmm.
that's one of the little things. There are a lot of little things we could talk about if that's what you're interested in, Sarah, in hearing certain breathing techniques or things that we can do while we're driving or in the car while we're at work. There are a lot of little hacks on how to kind of reset yourself when you're pretty exhausted, because I think the last thing we want to think about when we're working on everyone else is, oh, dear God, please do not make me work on myself too. Like, that's the last thing I have time for, right?
No, that's true.
Mhm. No, that's really helpful. I think it's just good to have these little tricks. And I know nurses, especially, like that time alone in the car going to and from work might be the only time you have for that day. So even something like the breathing or thinking to yourself, what are some easy tasks that I can do, some low hanging fruit, the 5 minute clean, I really like that. I think these are just really important little things that we can do to sort of bring our stress levels down and have a little bit more control in our lives.
Yeah.
I was gonna say, yeah, I think for me, like even just kind of reading some of through your book is the hold on and let go is for me the hardest part, right? The like I might have gone through all of the other steps, but it's like, okay, how do I not hold on to the anger, hold on to the anxiety, hold on to the moment that I'm dealing with. And I know for me that's always my biggest hurdle, and I know for other healthcare professionals too, that's probably their biggest hurdle as well, cuz like yeah, I think we can do the pull back. I think we can do the middle finger, putting it in motion. We could do all that kind of stuff, but it's just the okay, um you hear it a lot, the saying where it's like check your feelings at the door. I actually hate that because
Mhm.
we are human beings, and we take a lot of these things where we go, whether it's work, whether it's home, whether it's school. We can't just all of a sudden put one hat on and then take it off and it's gone. So do you have maybe one quick practical thing we could do about the hold on and let go, and then
What I do, so when I used to drive into work, I'm working remotely right now, but I'd find myself driving home, and instead of looking at like the gorgeous sunset, here I am in Southern California, or just looking at the sky, I would be like, I'd find myself with these angry thoughts. So, whatever kind of mood I left, if I was frustrated with something that had happened at work or stressed out about, something that had happened in a session, my brain took that emotion and then just would go with it. And
yeah,
I'd be driving home and all of a sudden I'd be like, why am I thinking about such angry things? And I stop myself and I just say, okay, is this thought process that I'm having right now of benefit to me in this moment? Is it serving me, or is it serving me
Mhm.
to hold me in this emotional state? And most of the times, I'm not sitting in my anger to solve a problem. I'm sitting in anger because my brain is wired not to shift gears. It's really
right,
hard for our
Right.
brains to shift gears. And so if I ask myself, is this serving me? And the answer is no. That's when I'm driving home, the music comes on, the window goes down, whatever it is, I
right,
practice shifting my attention to something else. And when we do it in small areas, the biggest example that I give to my patients that resonates the most is they decide they're driving home and they're really stressed, and all they want to do is go home, and the fuel light comes on in the car. And they're like, "Oh, forget it. I'm just going home. I'm just going home, just going home." And they pull in and they're like, "Oh, I'm home." And then they go, "Oh, I have that meeting tomorrow morning." So all night they sit with this dread in the background of like, "Oh my gosh, I have to get up early in the morning and I'm so tired." And then they're
yeah,
thinking about it, then they can't sleep. And in the morning they hit snooze so many times. They get up, they get in their car, they turn it on, then they're like, "Crap, I have to get gas." Okay.
yeah,
Like 99% of my patients do this. I used to do this. So what I tell them is, I don't care how tired you are. If that light comes on, Look for the nearest gas station, pull over and get gas
Yeah.
before you even think about it, and get in your car and drive home. Because when you get home, you're going to be like, you're going to relax. You aren't going to have to think about it at
Exactly.
night. And when you get in your car the next day, you are going to feel so good when you turn it on and it goes to full. And your brain has just
Right.
learned something very important. You did something that you didn't want to do, and no one died. Because of
Right.
that internal resistance we have is still built into that fight or flight. It's that, no, I'm just going to do that. But when you practice shifting gears in these areas that seem to be pointless, like who cares about gas? But those are the little things that add to the irritabilities of our day. And when you practice in these tiny little areas, it makes it a lot easier in the bigger areas. When you say are having like a disagreement with a coworker and then you need to go home and you'll come back to it tomorrow, it helps us, particularly people like me who don't compartmentalize very well. It helps me to kind of give a space for where I am in that moment. So, in my car driving right now, or as I'm at home chopping veggies, do I need to be worried about that next board exam I have to take in 3 years? No. So I'm just gonna sit here and chop veggies like I'm on Top Chef, and I'm gonna, like, get some crazy spices out of my cupboard, and I'm just gonna enjoy this moment now. It's that mindfulness, learning to keep stress
Right.
only in the moments when it benefits us.
Oh my gosh. Like I was just about to say, I'm like, are you in the back seat of my car? Like, how do you know this about me? Oh my God. All right. You know what? I am so grateful for you. So my last question to you, you are always helping other people. You're always looking out for other people. You are the psychiatrist. How are you doing?
I have ups and downs. I had an old professor who used to say life is like a sine wave. It goes up and down infinitely in both directions. And for listeners who aren't nerds or have PTSD with anything that has to do with chemistry and physics, that sine wave just is kind of like that wave that's up and down forever and ever.
Mhm.
And that's how
Yeah.
life goes. And I was thinking about that once the pandemic hit. And because I was doing fine, and then I'd like bottom out, and I'd be like, wow, like I'm really depressed. And then like a certain amount, a few days later, whatever, I'd wake up in the morning, I'd be like, hey, good morning. And I'm back to dancing around my bathroom, getting ready. And, I've just had this, I've just realized. So I take these points when I'm down, and that's when I really try to get out some new coping strategies and find new ways. And so in the summer, I was outside a lot and into the night with just listening to some classical music. And I had some raccoons who had babies in my yard. So I watched the babies play. Like I was all curled up.
Oh.
During the day, I had these squirrels. They started training the squirrels, and with nuts. And anyway, it's silly. But, I've found, now that we're in the winter, I have this little ritual at night. I'm on the Clubhouse app, and there's a lullaby club. And so it's live, quiet music from
Oh
9
my
to
gosh, I should check
11.
that out.
And yeah, if you're in Clubhouse, or if you're not, let me know. I'll send you an invitation. But 9 to 11 Pacific every night, it's just these young emerging artists, and they sing originals or covers, but quietly. And you have to whisper in the room. You can't talk, you have to whisper. And so I turn on the fireplace and I light a little candle, and I like get in my PJs, and like that's my new thing before bed. And I realized at first I didn't know why I liked it other than the obvious. But when I grew up with music in my bones. Like I had friends who had guitars, and we would be out, in Santa Cruz, in the redwoods around a campfire or at the beach, and we would sing. And so I realized it was bringing something of my old self. When I got out my Christmas ornaments this year, I found this ornament that had a picture of me, the preschool one where like the teachers like pin it
Oh,
on,
yeah.
and yeah.
Yeah.
So I was looking at that, and I was just feeling so sorry for myself. I couldn't see my family, and I was like, boo hoo. And not to minimize how I was feeling, but I looked at that picture and I just thought, what would 3-year-old Jenny say about Christmas alone? And I started thinking, you know what? She'd want to curl up in a blanket and make a blanket fort and drink hot chocolate. And she'd want to do, and I started thinking about all these things that this little girl in me would want to do. It didn't build a blanket fort, but I looked at all those little kind of comforts and I thought, I need to tap into this little girl because she's going to tell me, you don't have to be nervous about this. And your book's coming out and you don't have anyone to celebrate it with. Like all the things your adult brain tells you to be sad about, that 3-year-old
Right.
knows how to make it better. Because kids just know
Right.
how to make things fun, even if it's just spinning around in circles until they fall, right?
So true.
You all know you give
So
kids toys and they play with the box. They don't play with the toys.
yes.
Yes, so
So
true.
I was just like, what can I do, this Christmas or the New Year's, all of the holidays, my birthday, like, how am I going to play in the box? And
Right,
so
right.
I just, every time that slump comes, I think about how do I change things up a little bit differently and tap into the creativity to find the new thing that'll pull me out.
Oh
I
my
love that.
gosh. That is
I think that is so good.
amazing.
It's just
That is
sort of
so
going
powerful
back to
too.
your comfort, right? Like what you knew as a child. I think it's just really, really grounding. And I just love all the stories that you've told today. I think a lot of them are going to stay with me because I'm like you. I love stories, and that's how I learn and that's how I remember things. So I just wanted to thank you for coming on today and sharing just a little bit of the vast amount of knowledge you have and talking about your book and the different tools that we can use. And I really wanted to thank you. And I think that you have something really special. So
Well, I am so privileged to be here with the two of you who are just, you guys are the cool thing in Canada. Like you are the cat's meow up there. And I'm so happy to be on your podcast. It is so fun for me to meet just two amazing young humans who are doing such a positive service for those of us who are in the healthcare industry. So I just want to thank you for the work that the two of you do. And I heard there may have been a little meeting with your government going on, and you girls just are rocking it. And you're trailblazing, and I love to see women just rising up and using their voices in such a powerful way. So, like, I'm just so happy to be here with the two of you.
thank you. And where can people find you? Where can we find you online and where can people buy your book?
Okay, so the book is, I have no idea in Canada. In the US, it's in Target and Barnes and Noble, should be in anywhere books are sold. It's on Amazon and Barnes and Noble and Target, they have the online too. Um, on social media, I'm on Instagram, but you'll laugh because like I'm not like a fabulous Instagrammer. I need to hire like a millennial or someone who can just make it cool. But there's a lot of Jennifer there's a lot of Jennifer Loves on there. So I am Doctor, which is Dr_author_ Jennifer Love. So you can find me there. And I'm on Clubhouse too. If you're on Clubhouse, then I'm under Jennifer Love. And if you aren't, then let me know after and I'll send you invitations because I think you'd love it.
Yes, I have one for our gritty nurse, but it'd be nice to have personal ones as well. So that'd be really cool. Thank you so much for coming on. We are grateful to have you. This was a great conversation.